Hi, I'm Dr. Allison Applebaum, and I'm a clinical psychologist working with caregivers of patients with cancer. I've also been a caregiver myself, so I know what you're going through as you juggle multiple roles and responsibilities on a daily basis. In this video, we're going to talk about how learning to cope with stressful experiences can help you to stay well. It's common for caregivers to feel overwhelmed, tired, sad, afraid, isolated, and frustrated. As a result, some of you may experience anxiety and depression. If this happens, it's important to make time to talk with your doctor or other healthcare provider. There are a few things you can do for yourself when times get tough. First, ask for help. Don't be afraid to lean on your family members, friends, and faith community. Make a list of things you need help with and ask certain people for specific things, like driving your loved one to a medical appointment, swinging by the pharmacy to pick up medication, helping with your yard work, or even grocery shopping and house cleaning. When you ask for help, the more specific you are, the better. The demands of caregiving can be overwhelming, so reach out to others and ask them to lend a hand. Second, stay connected to your hobbies and friends. Things that bring you joy shouldn't disappear because you're a caregiver. It might be harder to find time for them, but you should make your own self-care a priority and do what fulfills you. Having close friends or other family members come once a week to provide you respite could allow you the time to meet a friend for lunch or hit a few balls on the golf course. If you can't get away on a regular basis, it might be easier for you to stay connected with friends through a weekly video call, like FaceTime or Skype, so that you feel like you're interacting in person. Make a weekly appointment for your self-care and plan for it, so that you have the support you'll need to take full advantage of that time. Staying connected with activities and friendships helps reduce feelings of isolation and can ease your burden. Third, try to laugh each day. Researchers have found that laughter can help you to feel better. So try to find humor in something each day. It's as easy as searching for a blooper video on YouTube, reading an entertaining book, or finding a favorite comedian doing a stand-up act on late-night TV. Finally, make sleep a priority. Without proper sleep and rest, it may be impossible to juggle all of the demands of caregiving. And poor sleep and fatigue can contribute to feelings of depression and anxiety. Practicing good sleep hygiene can help, which includes getting exercise during the day, limiting your caffeine and alcohol intake, limiting daytime napping to 30 minutes, and turning off the computer and phone screen at least an hour before you'd like to be asleep. Many people have found that white noise helps them drift to sleep, while others have used mindfulness meditation techniques. While it may not always be possible to get a full 8 hours of sleep each night, if you start to implement some of these things into your nighttime ritual, you might see an improvement in your sleep quality over time. Keep in mind that it's normal to feel overwhelmed at times, but it's important not to let these feelings get the best of you. Take some time to think about how you're feeling and how those feelings are affecting your ability to be a good caregiver. The most important thing to remember is to cut yourself some slack. Be nice to yourself. If you feel like you failed in some way, remember that everyone makes mistakes and you're doing the best you can. Self-compassion is often forgotten when under pressure to always be present and perform. Be mindful of times that you're judging yourself or being harshly critical, and replace these thoughts with positive and forgiving ones. Thanks for watching. For more videos in our Caregiver series, be sure to check out cancer.org/caregivers.